Hey, it's Mark the dentist, dental shaman, back again for number 5 of my mini-series on what good quality tests should we be looking for before making big decisions on our oral health. And number 5, which up to point is my first one, is measuring the acid-alkaline balance of our mouth, because it should be just over neutral, about 7.2 on the pH scale if you know your scales. But neutral or green on the paper is what it should be. And when I test my patients, I'm horrified. Most of my patients are in the yellow or orange zone, meaning they're acidic. The moisture that we're creating is actually therefore dissolving our teeth, because if it's acidic and our teeth are made of crystal, our enamel is made of crystal, it's going to dissolve, maybe slowly, but it will still dissolve in that acidity. So we need to know if you've got an acidic mouth. If you're super healthy, maybe over healthy, become a breatharian and just eat very minimal food and eat lots more vegetable, plant food. You may even tip into the more alkaline zone, which may have some side effects and some issues, but not so much with the teeth. But ideally we should be neutral. So how do we test that? Well, if your dentist is on it, they'll have litmus paper. We've all played with litmus paper at school in our chemistry days, our science days. Just a little piece of paper that changes color depending on the pH of the liquid that we're testing. And remember those colors? It comes in a scale like this, a little piece of paper like that, which we can just lick or suck and moisturize with our saliva. And if the dentist doesn't have it and doesn't want to get it, then you just order it online for about £2 or £3 English. You can get a whole pack of 100 strips of this stuff. Okay, some people might have it for their swimming pools and hot tubs if they've got those kind of products in their house. And that is how you test your saliva. Okay, then on top of the pH of the saliva, just ask yourself, when you wake up in the morning, are you waking up dry, meaning your tongue is a bit sort of stuck to the roof of your mouth, or it just doesn't feel moist at all? Or do you feel like really super moist? And then the other question is, are you somewhere in between if you're neither of those two? And if we want to get really serious about measuring what we call saliva flow, we can measure that. But just by asking yourself that question, that will give a good indication whether you have a dry mouth syndrome or not. And it could be temporary if you have a cough or a cold, but I'm talking about on a regular basis. Okay, so we need to know that. And you may be aware of it if you snore a lot or you breathe through your mouth a lot, because that will mean that you're air drying your mouth. So that will be the cause of your dry mouth if that's what you're doing. But first of all, let's find out if you have a dry mouth when you wake up. So that's the sort of information that I feel is really essential for treatment planning someone's rehabilitation and future well-being. All right, so that's number 5. We'll speak to you tomorrow about number 6.